So again, good morning, and we'll go ahead and move through our PowerPoint here. Just a few notes about some housekeeping issues. We are going to make this recording available on our OHS website. It is a responsibility of the agency admins at each agency to disseminate that information once it goes out on the website. If somebody wasn't able to be here, we want you to send it out to them. They need to have the information. This is all important stuff. So whoever you feel like needs it, you got to send it to them. For the duration, while we're talking and as we're going through some stuff, go ahead and keep yourself muted as much as you can. If you have a question, feel free to come off mute. I said, you can raise your hand, you can put it in the chat. We will be monitoring the chat as we go through. And like I already said, the recording needs to be disseminated, but it is important to make sure that's noted again, because we want to make sure that everybody gets the information and gets it from the source. One more note about some housekeeping things, but you probably all have met her or talked to her already. But we do have a new HMIS system administrator, Amanda Larson. She's here with us today. She is going to be your primary HMIS contact from now on, for as long as she chooses to stick with us. And I still want to be CC'd on the communication about HMIS and data related issues. Sometimes, we collaborate on some data requests, or sometimes there's an issue that we both have to put our heads together on. So please keep me in the loop, but just don't forget to add her onto any communication when it comes to HMIS or data requests. So Amanda, thanks for being here, and you'll hear from her today. She's going to cover some of our stuff. So let's look real quick at our agenda. It's a big one, but don't freak out. It's all going to be good. We are going to talk about the Social Security number updates. That was a change that the vendor made to Clarity. We're going to look at how we upload files into HMIS. We are going to talk about referrals, which we just had some communication go out about a report that's available, but we'll show you in the system where to find those referrals and what to do with them. We're going to talk a little bit about the outreach module, which is relatively new. And we're going to talk about some data quality monitoring issues, some common issues that we're seeing. We're going to review the process again, just to make sure everyone's clear about what the expectation is. We're going to talk about a new data element that we're going to drop here on 10.1. And we'll talk a little bit more about that. And then we have a lot of things coming soon, a lot of big things on the horizon. One of the things that, again, I'm excited about is that HMIS is at the center of a lot of the initiatives that are coming our way for the continuum. And I think it's really important. The better data, the better our data, and the better that we can then advocate for more funding or more resources in our community. And I'm really happy that the COC has agreed to keep HMIS at the center. And so you'll see that as we get into the coming soon portion. And then at the end, we'll just open it up for questions and answers. But again, I don't want it to be like that's why I call this a work group. You guys, I want you to come off mute, talk to me as things come up for you in your head. Don't feel like you have to wait until the very end when it's open question and answer. Okay. So before we get into the first topic, any questions? Okay, Sharon, I see your hand up.
Will we get a copy of this information?
Yes, the PowerPoint along with the recording will be on the website.
Okay, great. Thank you.
Yes. Jeanette? Oh, you're muted.
I'm sorry. What is COC?
COC, a continuum of care.
Okay.
Yep.
Okay.
So all of us that are working, within HMIS, we're a part of the COC, the continuum of care. So, we view ourselves as a sort of spectrum of services, and you all play a major part in that. So.
All right. Thanks.
Mm-hmm. All right. Well, I'm going to hand it off then over to Amanda to cover our first topic.
All right, so we're going to start off with the Social Security number update. A lot of you may already know this just from being in the system and doing your intakes on a day-to-day basis. I also had sent out an email about this just to let you know when it came out live. So I'll go over it again, just so that everybody's on the same page. So the Social Security number updated its logic in HMIS. So one of the new updates that occurred is the warning message that you guys will get if you are entering an invalid Social Security number. So the system will check to make sure that the Social Security number that you guys are entering in HMIS is valid based on the administration guidelines. So that means just what the Social Security administration labels as a valid Social Security number. And we have listed here of what is included as an invalid Social Security number, which that would be last 4 digits are 0, the first 3 digits are 0 or 666, or it starts with 9. I'm going to make a note here because a lot of our participants who are immigrants often are given an identification number that starts with 9, and we use that a lot with putting that in as Social Security numbers for those types of participants. You will still get a warning about that, but that is still okay. I know that when I'm going through your data quality monitoring every month, that they will come up as I don't want to say an error, but like that approximate or partial Social Security number was reported. And so we just check on those. And if I see that it's a 9, that we will not include that as error in your monthly reporting. More points that would make a Social Security invalid is that the middle digits are 0. There are repetitive digits, and the digits are sequential. That means it goes in order 1, 2, 3, 4, 5, 6, 7, 8, that kind of stuff. Now, with that being said, there was a new update where instead of if a participant has an unknown number in their Social Security number, the logic would be enter in zeros for that. The change has now moved over that if there is any number that is unknown, you're going to put an X in instead of the zeros. So if there is a participant who has a Social Security number that they don't know at all, you would put all X's in for that. If they know a partial, like the last 4, you would enter the first 3 digits as X, the middle digits as X's, and then the last 4 as the participant reported to you. Now, the logic is written into Clarity that if all the digits are entered in as an X, the system will automatically change the next question of the data quality of the Social Security number to client doesn't know. Because if you're putting in all X's, there's no known Social Security number, so it automatically is going to be put in as client doesn't know. Going off of that, if some digits are entered in as X, like my example earlier, if the last 4 are known, but the beginning of the number is not known, the data quality of the Social Security number will then automatically put in that an approximate or partial Social Security number has been reported. So I'm just going to go ahead and switch over to our system right now to show you what that will look like, live. Okay, can everybody see my screen now that we switched from the PowerPoint? Okay, great. So I'm going to note just off the bat that my Clarity system looks a little different just because of my access level. So I am under the coordinated entry level, but you guys should see your own agency there. I'm going to look up for our fake client, Happy Halloween, everybody's favorite. And we're going to go into this profile. So this is the profile level. As you can see, we have our participant's name up at the top. All the tabs underneath the name of the participant is what we consider the client level, which you guys probably are aware of. So we're going to go into the profile on the client level, and that's what automatically pops up when you search your client. So right off the bat, we have our Social Security number as the first question being asked. If you have to go into edit, it's automatic putting the X's for privacy reasons, excuse me. So we're going to go in and enter We're going to enter in a full Social Security number. Okay, then you get your little notice above that you're going to be changing core data. You're going to hit OK to hit save. And as you can see, automatically the next question, the quality of my Social Security number, has already been automatically put in for me that it was the full Social Security number that has been reported. If I were to go in and edit where I don't know any of the numbers, hit save. As you can see, the quality of the Social Security number now automatically changed. The client doesn't know. I didn't have to change that solely. They're just putting that in there from what I put in the number from the Social Security number. Any questions there? I'll take a moment to stop, see if there's any questions. All right, we could go back to the PowerPoint then. And we could go ahead to the next slide, Nick. All right, our next topic is uploading files into HMIS. In case you were unaware, we do have the capacity in HMIS to upload participant documents on the client level and on the program level. So if you want something that may be like a client level is an ID to upload, or a Social Security number, something that may be specific to the program level is a lease for PSH, housing documentation, things like that. So where can you upload these? The client or all program levels, like I had just said. Any file can be uploaded from your computer as long as it does not exceed 25 megabytes. Excuse me. We're putting this in the PowerPoint just to emphasize that it could be, beneficial to having these documents in HMIS just because of the nature of the work that you guys all do. I'm sure it's difficult for sometimes the participants to keep track of these documents. Therefore, if they're entered into HMIS, they're all in one central hub to be able to access. This will also be integral into the new housing application process that's coming down the pike, that Nick will go into more detail later on in our presentation. Now, who can update or upload files? Anybody with edit access within your agency is able to do this. As you can see on the right, there's a little screenshot of what that looks like. The arrow pointing to the files is that client level tabs. So I'll switch back over to our Happy Halloween so I can show you what that will look like. Based off of the screenshot that was included in our presentation, here is the files that the red arrow was pointing to. This is the client level. So once you go into the Files tab, as you can see, Happy Halloween doesn't have anything up in their profile right now. If I wanted to change that, say I was working with Happy Halloween and I got a copy of or a picture of their photo ID, I'll go into this tab under Files and Client Files. I'm going to hit Add File, the little Add plus button. Now there's different categories, as I'll point out here. There's 5 different categories. So you're going to want to choose what category kind of fits what you're uploading. The different categories are family, social, and legal, finances and income, health and medical, housing documentation, or personal identification. For my example, I am going to be uploading Happy Halloween's ID, so that's a personal identification. Now, based on the category that you choose in the system, another drill down option is going to give you different parameters that may be more specific to a personal identification. Birth certificate, driver's license, passport, photo ID. I am going to do a photo ID because I know Happy Halloween does not have a driver's license. So that's the one I'm going to choose. You can also use this toggle if you want to keep it private. Nick, remind me, does that mean that if they toggle it on, that it's only going to be accessible to whoever edited it?
Yeah, whoever in that agency. So if you at your agency make that private, then just people who work within HMIS within your own agency will be able to see that document.
Yes. So certain things, maybe like photo ID or social security number, might want to keep that non-private so that different providers who are also working with the participants are able to access that as well. That's what the importance comes from, having HMIS as the central hub so that everybody can access these documents. So then you would just select the file from your computer that coincides with what you're uploading, and then you will hit add record. I obviously don't have a photo ID for Happy Halloween, so I'm just going to hit cancel. Now, I want to show you guys what it will look like when you're uploading documents on the program level. So we're going to go to the program tab on the client level under Happy Halloween's name. And I can see that she's enrolled in a couple programs, but I'm going to go to the coordinated outreach. And now we see a new level of tabs that open up, and this is the program level tabs. So as you can see, under the program level, we have a files. I'm going to click that, and it's the same logic as it would be for when you're uploading files on the profile level. We got link from files and add file. You're going to hit the add file because this is what's going to upload from your computer. Again, they have the same categories as I discussed for the profile level, but maybe I'm going to do housing documentation just so that as they're being referred from coordinated entry, they could see that they have those documentations. This populates a whole different, options to choose from based off of the category housing documentation. They got budgets, a client contract, eligibility determination. So a lot to choose from. Lease. They also have ID photo cards in this one. Proof of income, utility bill, W-9, anything that you can choose from here. Again, you would select the file, and then the private toggle works the same function as it would from the profile level. Okay. Nick, you want to go back to the PowerPoint for me?
Sure. I just want to add, sorry if I'm getting ahead of you here, Amanda, but I just want to add that Amanda and I do have the ability to edit or add options under all those categories. So if there's something that you're uploading where you can't find like the right name for it, instead of choosing other and then typing it in, we can add that for you. So you'll actually have it to select for multiple people. The other thing that I just want to clarify, the difference between sort of the client level versus the program level. People will still be able to see what you are uploading at the program level when they go into the history. So it's not like there's a privacy thing there. There's no difference in terms of who can see what. But what is important is that it's linked to your program. So if you wanted to maintain sort of a record for yourself of the things that are uploaded for your program, you would want to do that under the program level rather than the client level, because that's sort of like the global place to upload files. It's not specific to your agency or your program.
Awesome. Thanks for those tidbits, Nick. Any questions on uploading the files or anything at this point? All right, thank you. I'll go ahead.
Just Amanda,
Yes.
quick
Yes.
question. So if we upload a file, do other people have the ability to edit it or remove it?
I don't believe so. No. I think only we can delete a record that's in the system. So if you upload, Nick, remind me, if they upload something by mistake, can they delete it since they have the edit access? Yeah. So if you upload something by mistake, you are able to delete that. If there's something in the system that you think shouldn't be there or you're not too sure, then that's something that you would want to reach out to us for, and we'll take a look at it.
Okay, thank you.
Yeah, it's a good question, Lisa. The screenshot that's on the screen right now, it does say modify file, delete file, but that's, again, that was at our level, our access level. Um, I'm fairly certain, double check for me whenever you want, but I'm pretty sure that you're not going to see those options unless you are the person who uploaded that document.
Great.
Any other
thanks.
questions? Yep. Okay. Well, I will move along here. And let's talk about the referrals in HMIS. So, as most of you are aware, Coordinated Entry is right now the only entity that's pushing out referrals. And what we discovered through a lot of different conversations was that people were getting sort of lost in the sauce, right? There was a lot of referrals going out from Coordinated Entry. People weren't really aware that those referrals were getting pushed to them. Maybe they weren't being notified. Maybe HMIS wasn't working quite the way that it needed to inform those agencies that they had referrals sitting waiting for them. So we wanted to sort of beef up the way that we are talking about referrals. And so one of the things that we did, and I didn't include this here, but you all received some communication about a report. So Amanda and I built a report that looks at the referrals that have come to your programs within the last 3 days from Coordinated Entry. That is actually, excuse me, sent out daily. And it's going to, the people who you all identified for your agencies. If you did not opt in for that report, then you are not receiving it. So don't be alarmed. And this was really meant for shelter transitional housing programs too. So if you're a housing provider and saying, "Oh, I didn't hear about that," that's on purpose. We only did that for shelter and transitional housing, sort of that crisis housing need. But the rest of you, so everybody still has a responsibility for these referrals, okay? Um, all agencies are responsible for checking on the referrals made to them by Coordinated Entry. Let's just say that flat up front. You all need to be checking your referrals if you are a shelter or transitional housing program. Specifically, agency admins have the responsibility for that function, for checking the referrals and making sure that they are the primary contact when HMIS issues arise, just like all other issues, right? But we're sort of saying, look, as the agency admin, you are responsible for what is coming to you from Coordinated Entry. Once you know about a referral, you then have the responsibility for outreaching that person. Most of the time, not all the time, most of the time, the participant who's coming in, they're calling Coordinated Entry, is giving some sort of contact information. For those of you who are doing Coordinated Entry on this call, whether it's data entry or you run the program, Nikki, I'm looking at you, make sure that we're getting contact information the best that we can at every step of the way, so that people can call folks who are being referred to them. Do you still need to come to Stella Maris? Do you still need to come to Whitehaven? Do you still need to come to Norma Her? Whatever it might be, right? We haven't seen you yet. Are you planning on coming here? That's a part of the responsibility on the agency for each shelter and transitional housing project. So locating and handling those referrals obviously is going to be really important. So again, this is outside of the report that's created and sent out every day. But what you can do is on the search screen up in the top right-hand corner, there's a referrals button. You can click that. Pending referrals is the first thing that shows up. So you click it, and again, I'm going to show you this in a second. You'll see pending referrals. The referrals that are in there are automatically going to be denied and expired after 30 days goes by without any action in their profiles, okay, in their records. So sometimes you're going to see referrals that have been there for 90 days, okay, 100 days. And the only reason that they haven't been expired is because maybe they're part of a program where a service is being entered, once a month, or a new assessment has been completed for some reason. So those referrals will stay out there and stay pending as long as there's still action going on in their record. All you have to do to satisfy a referral, to sort of complete the loop, is you have to just enroll them in your program. So if they never show up to your program, hopefully, again, eventually it'll expire. You have nothing you need to do. But if they do show up, you have to enroll them, ensure that that referral is there. Obviously, it will be because you'll have already checked it, and then it'll close the loop automatically. Okay, so real quick, let's just take a look at what that it looks like in the system. Are you seeing clarity now? Okay, good. Let me blow it up a little bit. So I'm going to go into a different agency here. So again, mine looks a little different than yours, but let's look at City Mission real quick. So up in the top right hand corner on your search screen, you're going to see the referrals tab. You go ahead and click referrals, and the first thing that pops up is a pending referrals screen. So you can see the client's names. All right. You can see when that referral was put out to you. Are they qualified? Everyone's going to be coming up as qualified, FYI, because we don't have any eligibility criteria in the system. And then how long that referral has been pending. You can easily access people's profiles by clicking on the name and going into them. The edit button on that screen just looks at the referral itself. So you're not going to be editing the client's information at that point. You would just be editing the referral information, which we don't want you to do. We just want you to go into the profile and enroll them should they show up. If let me back up. If you do click on a name and you want to contact them, the contact tab here at the top is where you're going to find that information. You can see that the client gave a telephone number and you're able to outreach them via phone. Okay. People do give emergency contacts. Please don't call the emergency contact for the referral. So, don't call the friend, right, of this person and say, hey, I'm looking for him, want him to come to City Mission, right? We don't expect you to do that. If there's no client information, we want you to reach out to coordinated entry, look in further into their profile to see if they're enrolled in any other programs that you may be able to contact. Maybe the last program that was served them has some information that you might be able to outreach them with. So again, I know that HMIS staff on this call, if you're just doing HMIS data entry, I know you're not going to be the ones that are responsible for this. But if you are doing sort of a hybrid position where you're doing HMIS and you're programmatic, that is the expectation that you are reaching out to people who need this service from you. Okay. Any questions about that? Nothing. Okay. Let's move on. So really exciting stuff here, outreach module. So again, relatively new. We rolled this out at the end of, I believe, last year. And then the cold season came around and sort of things fell off a little bit, but we're sort of back on the horse trying to get this in greater use. The outreach module is a geolocation-based module within our instance of Clarity. So it's a map-based software that allows us to actually pinpoint where people are staying. They're either in an encampment or they're just living, somewhere by themselves. We're able to pinpoint them on a map, just like you would with any GPS. When you take a ride in your car, right? It's pinging you, and that's sort of what we're using this for. It's a very new and innovative way to track unsheltered homelessness. That has been a huge gap in our system for many, many years. We have not had a really good sense of how many people are staying on the streets at any given point in time. And so this is giving us a tool to track that, to be able to see it in a little bit more of a real-time nature. Not only do we have the ability to track the encampments and sort of the people that are living there, we have the ability to track program enrollments from the encampment. So we're able to determine how long people are staying in those encampments, which really helps us to determine chronicity. So right now, if you're familiar with the process for documenting chronicity, you have to write a letter, put it on letterhead, you have to verify that they've been staying out on the streets and where they've been staying. We're sort of saying, well, let's use HMIS to do that. We now have the ability to show when people are staying, where they're staying, and for how long, right? not only are we tracking stuff about the people living there, but we're also now able to track characteristics about the encampments themselves. What do the encampments need? Do they need um, mental health services? Do they need trash pickup? Do they need a cleaning? Do they need sanitation services? Do they need a porta potty? Right? Like these are now things that we can sort of mobilize services to go do. We're not quite there yet. Our response isn't there, but that's what our goal is, right? To eventually get to a point where we're working in coordination with the outreach teams to determine what kind of services these folks need in these encampments and get them what they need to live in a dignifying way, right? Where they choose to. If you haven't heard of this, or if you've never seen it before, don't be alarmed. We've limited the access to this module on purpose to people who are doing outreach. But everybody has a role to play should you choose to accept that role. So let's talk a little bit about what that means. There are two ways that you can actually contribute information to the outreach module. The first is the location tab. Many years now we've been in Clarity, and usually when we do trainings we always skip over the location tab because we don't really use it, but now we are going to be using it, and it is in use, I should say. If you are certain that somebody is staying somewhere, you know exactly where they're staying, you can actually go into the location tab, drop a pin on the map, and it'll actually carry over for us on the outreach module. Now, I know that things can get messy that way, right? Especially if you're not certain. So that's why I've bolded that word. Make sure you know exactly where they're at. If you just have a slight question in your head about where somebody's staying, don't put them on the map, please, right? Just let the people who are doing outreach do that. Okay. Again, these are people who are homeless. So if you're a shelter provider, if you're and they're staying in your shelter, or if you're a housing provider and they're staying in your housing, you don't need to include their location. This is just for homeless folks, literally homeless folks. Okay. You can add an address. You can drop a pin. I'll show you what that looks like. There's also programs that require a current living situation assessment. So if you're one of those programs, you're not going to be shocked by hearing that term. But for those programs that require that, there's also a geolocation function. We've added that to the current living situation. So if you choose that someone is staying, their current living situation is a place not meant for habitation, you then get an add a location button that you can click and then drop the pin on the map. Now, again, if you're not sure, you're not getting that information from the program staff, whatever it might be, don't drop the pin. You can just say place not meant for habitation and move forward. You don't have to drop a pin. But once that CLS is completed, the current living situation assessment is completed, the outreach module will reflect that information for us. So you might not be able to see the map, but people who are doing outreach and our system admins will be able to see what you've done. Okay. So let's look at this real quick. I want to give you just a sneak peek at some of the stuff. In the location tab, right here at the top, you can come here, hit add an address button, and you'll select what it is, right? If this is an address, and again, we're looking at unsheltered people, right? We're not asking you to put any of these other things in. I don't care about their mother's address. I don't care about their legal guardian, right? I don't care about any of that. What we care about is the unsheltered people. So we're going to put unsheltered person. You'll name the location. It could just be, campsite or whatever you want to call it. And then you would add that location. And when you do that, you can then type in an address. It'll find it for you. Or you can just click drop a pin. Okay, and add. Now you'll notice down at the bottom here, there's a current location, because if you're doing that work, what's really cool about this functionality is that if you're doing that work, you can be out in the field and on your phone, because it's mobile friendly software, and you can actually click that button to find where you're currently at, and then you can drop the pin that way and be really exact about where that person is staying, right? So you would click add, and then it'll drop them on our map. I'm not going to do that for now. The location date here is just like the day you found out about it. It doesn't have to be, back when they started. It's just the day you found out. Is it an active location, right? If it's active, that's going to pop on our map. If it's inactive, we're not going to see it. And again, you can make it private, so just to your agency. That doesn't make it private on the map, though. Just FYI. It doesn't make it private on the map. It'll just make it private within the record, if that makes sense. Okay. So that's one way to add it. And then for those programs that actually have, I'm going to go do this again, excuse me. For those programs who do have a current living situation assessment required for their program, you can do it that way as well. So I'm going to go into coordinated entry, the outreach program, look at the assessments. The current living situation is here at the top. So if we start one, so it says the date of the contact. So let's say it's today. The current living situation is place not meant for habitation. Where do you sleep most often comes up, and you can actually add the location, and you'll see the same thing. You can drop the pin, put an address, whatever you want to do. Okay, so same thing, just a different way to get there. Any questions? None. Okay. We're either doing a great job at explaining it or people are confused. So I hope it's the first. I hope it's the last.
Nick,
Or the former.
Nick?
Yeah.
Yeah, this is Lisa. I couldn't get
Hey,
my
Lisa.
phone off. Couldn't get it off mute. So, question. So, and I know in our BCP program, there's a question about the current living situation. It's not necessarily the assessment, but it's part of the intake. So would that location tab come up?
Yeah,
there
so
as
you're talking
well?
about you're talking about the general enrollment screen, right? Where it says where was your prior living situation?
Yes.
Yes, that is not the same thing. It's different. The current living situation is its own assessment, usually required
Okay.
for coordinated entry and path programs, things that, outreach based. Coordinated entry is obviously the exception there, but yeah, that doesn't populate onto the map. So you would need to do the location tab for that program.
Gotcha. Okay. Thank
Yep,
you.
good question.
Nick, we got a question in the chat too
Sure.
from Luke.
Let's see. Yeah, Luke, we can scrub it. That was our actual outreach module, but there's no people in anything that I showed, so that's why I did that. But I'm happy to take it out. Okay. Any other questions? Okay. All right, let's talk a little bit about the data quality monitoring process. I'm going to hand it back over to Amanda.
All right. So data quality monitoring. Took the opportunity here to kind of go over the process. As you guys are all aware of, PDFs of the APR of your guys' projects are due to OHS every 15th of the month. So that's something that I'm taking over now. So we just had the review deadline for August's APR on Monday, I believe. So those who sent me their APRs, thank you. I'm reviewing them now. So you guys should receive your error rates sometime next week. So be on the lookout for that. So when you are sending the PDFs of the APRs, you guys should be sending them from the previous month's data. So for example, on Monday was 9/15 that you guys sent to me. That was for August's dated. So this is to only monitor what we see in HMIS. So with that being said, as you guys are HMIS staff for your agencies, it's a requirement that you all have your own internal quality monitoring process that you guys have to have in writing. This is important because you guys should all be checking to see that your internal records match what's in HMIS. So you guys should have your own process in writing and be facilitating that occasionally to check between the two entities. So that's important to make sure that your guys, what you're entering in HMIS is accurate for your own internal process. Go ahead to the next slide.
I just want to note that, I know that a lot of times it's a lot of work, a lot of admin work for people to have a database that they track stuff in, and then also have to translate it into HMIS. We're happy to work with you in any way possible to make that easier for you. We've worked with some agencies use HMIS as their record. And so I know some people can't do that for, Medicaid billing reasons or whatever it might be. But if there's an opportunity for us to use HMIS in a way that's going to help you minimize the amount of work you have to put into both systems, we would be happy to do that. But I just wanted to make that plug. So, all right, Nick.
Thanks, Nick. Okay, so in the 2 months that I've kind of take this over from Nick now, I just wanted to take the opportunity here to kind of discuss some recurring data errors that I've been noticing on the APRs that are coming back. So the first one being the annual assessments. As you guys know, if you guys have a participant who's been enrolled in your guys' project for more than 365 days, they need an annual assessment. I want to note that in order to pull the aggregated data into the APRs, the annual assessment has to be completed within 30 calendar days of the anniversary date of when they were enrolled into your program. So that might look like, okay, if you're counting 30 days exactly from the date they were enrolled is not always accurate. I have example here that say if somebody was enrolled on January 7th of this year, I saw that somebody put in the annual assessment for 2/7 because makes sense. 30 days from 1/7 is 2/7. However, that is actually 31 calendar days from the anniversary date. Therefore, it came up as an error on the APR because it was outside of that 30-day window. Therefore, it wasn't pulling the aggregated data and it was showing up as a missed annual assessment. So with that being said, it can be 30 days before the anniversary date or 30 days after. So I have a time frame from that example of the enrollment being on 1/7. The annual assessment then can be updated between 12/8 of the previous year or up until 2/6 of 2024. Like I said before, any updated assessment that is updated with outside of that time frame is going to show up as an error on the APR. So if you're seeing that in your errors that are coming back in the email from me, that annual assessment needs to be 30 days within the anniversary date, please check to make sure that it's the calendar date and count the days. I'll pause here because I see Tiara has a question.
Yes. If they were enrolled 1/7/2024, the annual assessment will be needed by 2/6/2025?
No, by 2/6/2024.
Yeah,
It's 30
sorry
days.
though, Amanda. I think there's just a typo here. So the enrollment date would have been, I guess, in this example, it should have been 1/7/23 to Tiara's point. So, because it's a year after. So yes, it's. Does that help?
Yes.
I don't know if that makes things more confusing. Okay, yeah. Does that, Amanda? Okay.
Yes. Sorry about the typo there, guys. Yeah, thanks for clearing that up, Nick. So that's what I wanted to touch base about the annual assessments. Just see if you're seeing that coming back on your error count. Just take a look at the dates. If there is an annual assessment already put in, it's probably because the dates are off or there isn't one. Just frankly, so that it will need to be updated. All right, moving on to sexual orientation. This is a new HUD requirement that came, I believe, 10/1 of last year. So coming up on a year now that this has been rolled out, and I am still noticing quite a bit of sexual orientations not being updated, specifically for PSH projects. This is a requirement from HUD for PSH projects. So I wanted to take the time to notice from especially this last month, what I'm noticing is that there's a difference from updating the sexual orientation in the profile level versus updating the sexual orientation in the program level. So going back to the examples that I showed you in Clarity earlier, it seems like at least this month when I was reviewing that a lot of the sexual orientations are being updated in the profile level. However, as you know, that's great. We need to have that information recorded in the profile as well. The reason they're showing up as an error on your monthly data quality monitoring is because it's not accurately represented in the program level. So when you're seeing if I'm sending errors back to you guys that I'm asking for sexual orientation to be updated, I'm meaning that it needs to be updated in the program level. So I'm going to switch gears here and just show you briefly in Clarity what that will look like. All right, everybody see Clarity up now. So again, we're in the profile under Happy Halloween. The bottom of the profile asked for the sexual orientation. As you can see, Happy Halloween does have sexual orientation updated in the profile. So if I'm coming back with your corrections and saying that I still notice that the sexual orientation is not updated, and you're thinking, well, Amanda, I know I did it. It's in the wrong spot, essentially, is what I'm saying. So here is in the profile. Now I'm going to go to the programs. However, Happy Halloween is not enrolled in any PSH program currently, but it is going to be the last question that's asked on those PSH enrollments. So just thinking that this is a PSH project, if you go into the enrollment tab under the profile or under the program level, excuse me, and you see all the information you entered from the enrollment, the sexual orientation will be the last question asked. So when you're going in, just be mindful to scroll all the way to the bottom and update that sexual orientation for the program enrollment. So because Happy Halloween had heterosexual on her profile screen, if this was a PSH enrollment, I would put heterosexual as her sexual orientation and then hit save and close. So just want to note that there for future. Any questions about that? Okay. All right, and going now moving on to the last point here is exit destinations. So oh, I see a question pop up in the chat. So Lisa's question is there a reason why the information doesn't transfer to the program level? It's because when when you guys are running the APR, it's taking it from considering as like a program specific data element at that point. On the profile level, that's considered a personally identifiable information. And that's really why on the APR it's coming back as an error because it's tied to the program enrollment. Nick, I don't know if you wanted to touch anything else on that.
Yeah.
But
Yeah, just quickly, there is a cascading function though that does exist. So, if that information is present on the profile screen before you enroll that person into the PSH program, that will be populated for you. It will transfer over. But what Amanda is seeing in the data quality monitoring process is that it's not entered at all, and people are going back to fix it on the profile screen as opposed to the enrollment. And once you've changed it because it didn't exist in the profile to begin with, it's not going to cascade over. You got to fix it in both places.
Okay, that makes
Yep.
sense. Okay,
Yep.
thank you both. Thank you.
No problem. Great question. Thank you. All right, moving on to the exit destination. So I'm noticing on the APRs that there's still being a high level of no exit interview completed as an answer. So when you're going through and exiting participants from your program, we know at OHS that it's common for participants to kind of disappear without letting y'all know where they're heading to or what their plans are after they leave your project. We understand that. But with that being said, we can't have, data not collected or no exit interview completed because that comes up as missing data on your APRs, which is an error. We like to see clean data. So that's why I just want to emphasize, please refrain from using those options because I will send them back to you to be updated. Like we can't allow those answers. So with that being said, I know we kind of touched base before saying that if you don't know where your participant exit to, or they kind of disappeared before letting you guys know where they were heading to, you could always utilize HMIS as a resource. So for example, if you notice your participant exited your project and you go in to exit them, but in their program history in HMIS, after they left your program or your project and you noticing that they have a coordinated entry enrollment after your project, then you could go into the exit screen and say that they discharged to a shelter or a place not meant for habitation because they're looking for those services again after exiting from your program. So that's something that you guys can utilize as kind of a way to dig a little more deeper into putting an answer that will show up as clean data in the APR.
Can I just add, Amanda, too, that this is becoming actually a bigger source of frustration for some of us who have been monitored recently. The state has come out both to OHS and I know LMM, and then I know other people have faced this, but I'm just using those as examples where, we had to come up with a response because some of our programs had such high what they consider to be error rates, right, for exit destinations because we didn't know where they went, right? It happens, we know that. But because we had answers in there, even client prefers not to answer comes up as something to flag. But at least we can explain that away a little bit better. But the people are paying attention to it. So the more that we can use HMIS to help us answer those questions, regardless of what the outcome is. I know people are always concerned, like, well, I don't want to say shelter if, we were supposed to keep them out of homelessness. It looks bad for our outcomes or something like that. Well, it looks better to put that than it does to say we don't know where they went, right? So just something to consider that if you do get monitored and you do have high error rates that are, over their threshold, which I think is like 10% or something, a lot of those agencies or a lot of those government entities will ding you or at least question you about those things. So something to consider, and that's why it's important, I think.
Yes, definitely. We like clean data. Any questions there?
Okay.
All right, awesome. Moving along.
All right, so 10-1. It's always my favorite day in the data world because that's when a lot of changes seem to drop. This is not one that HUD put through, but we did. So we're making it we're doing it to you, sorry. But essentially what we're going to do is add a lease signed date data element to our program enrollment screens for rapid rehousing and PSH programs only. So those that have leases, right? Starting on 10-1, we're going to drop it. We'll have it dropped probably on 9:30 if I had to guess. All active participants will need to have that data element entered on their enrollment screen. Now, I'm not saying you have to have it done on 10-1. What I'm saying is that you're going to probably have to go through your people as you go and enter in that lease sign date. Now, the reason for this coming up was because we realized that the housing move-in date meant something different to just different people. People operationally define that in different ways. And so the housing move-in date, well, let me back up. We added the lease sign date because it is distinctly different from what a housing move-in date is. And sometimes we were seeing that they were sort of being used synonymously, and then we had a lot of overlapping program enrollments because we had people who in shelters because they weren't physically in the unit yet, but they had the housing move-in date, that predated their enrollment or their exit, I should say, from the shelters or something like that. So the lease sign date is going to be added, and it should be the date on the lease, right? The date that they signed the actual lease agreement with the landlord. Okay. The housing move-in date is the date that they physically start living in the unit, the date they are physically there. That is the HUD guidance. I can send you that guidance. I'm not arguing with HUD about it. This is what it is. So the housing move-in date is when the person starts to live in that unit. Okay. You can be open in PSH and rapid rehousing prior to your housing move-in date, but your housing move-in date cannot predate your enrollment into rapid rehousing or PSH. So something to consider for that as well. So aside from new people coming into the program that are going to need this data element entered, you're going to want to enter it in for everyone else as well. So the people who are already in your projects. Now, that might take time, I understand, but those dates are going to be important. And I'll explain why those dates are going to be even more important as we get into the next section about things that are coming our way. But any questions about this data element? Yep, Sharon.
Okay, so, oh, I'm sorry, I just thought, so for, this is when they move in, so for like research and that kind of thing, it's just basically the actual date they move in. I'm sorry, yeah, that would make sense. I answered my own question, thank you.
Yep. So the lease date is when they sign it, and whenever they move in is the housing move-in date. The enrollment date can be whenever you want to enroll them, right? Like you can be open in your program, but usually I think for you, Sharon, I think things are different, right? Like when people move in, that's the enrollment date, that's the housing move-in date. It's like all sort of the same date, which is fine. The lease sign date can predate the enrollment. So like if they sign a lease a week before they actually move in, that's okay. That date can be before the enrollment date. So that's something for you as well.
I think Tiara might have had her hand up too.
Thanks.
I did, and now I don't remember my question. I'm sorry.
That's okay. Yeah.
Oh, I
just
do. I
to-
remember. I'm
Oh,
sorry,
go ahead.
Nick.
Yeah.
How far back are we gonna go in entering the lease date for rapid rehousing programs? I know you said moving forward, but like, are we going back?
Yeah. So no, we don't need to go back. It's just gonna be anybody who's active
Okay.
as of 10/1. Yeah.
Okay.
And I should also know, I didn't make this caveat, but the rapid rehousing, I'm only talking about those that have housing associated. So like the shelter project or the rapid rehousing project that you have, Tiara, and then like any of those other for the rapid rehousing for families project that is just services only, you won't have to enter this.
Oh, perfect. Okay. Never
Okay.
mind then.
Yep. Got a lot of hands. Okay, so Elizabeth was next.
I just wanted to know, like, for the lease signed date, are we putting that into HMIS? Because I
Yes.
know it's located in Yardi, so where are we putting it in HMIS?
It'll be
Because I do the
available.
data entry, so like for
Yeah.
the new like client change reports and stuff like that. So
Yes.
I don't know like where we're going to be going to put that information in.
Yep. So it'll be on the enrollment screen right under or right above the housing move-in date where you normally see that.
Okay.
It's not there yet. It'll be available probably, like I said,
Gotcha.
it'll be available to you first thing on 10/1's morning.
Okay. All right. Thank you.
Yep. And then is that
Rita-
Shamika?
I'm sorry.
Yes, yeah, it's
Hey.
me. Um, so should the enrollment date be like the date that we do the interview? and then the lease sign date, because our guys move in when they sign their lease. So when they sign their lease, they're coming with bags and they move in. So that's all one day. So
Yep.
should that enrollment date be when we initially interview them and start our paperwork?
No, I want it
No.
should still just be whenever you start really providing services to them, right? So like a lot of times sometimes people will use like the lease sign date as their enrollment date and then have some time in between that and housing move-in date. But yeah, we have something coming for the interview date, so we don't want to make that change to the enrollment date. But the enrollment date can be whatever you normally were doing with the enrollment date, keep doing it.
Okay.
Yeah. Teresa?
Hi there. You might have
Hi.
already answered this, but I just want to make sure. So are we going back and then checking all of our tenants to make sure these dates are correct?
Yeah, yes, we would like you to do that. Like I said, it's only people that are active on as of 10/1, so you can just pull a roster of people who are active. You you can take your time. I'm not going to put like a hard deadline on this, but we will be checking it, right? As we go through our data quality monitoring stuff.
Okay, thank you.
Mm-hmm. Obviously, I know people have a lot of volume sometimes, right? There's larger volume of people for certain programs, and so I'm not trying to burden you with extra work. I'm not going to say, you have to have this all done in a week. You just, we want to make sure those dates get in there. And truly, it came out of necessity. It came out of a request from Eden, and I think it made a lot of sense. And again, as we get into some of the other stuff that's coming, this actually fits right in line with how we're going to start tracking sort of dates as it relates to the housing process. So. Yeah, so again, you don't have to go back and enter this for everybody that has ever been in your program. It's just gonna be people who are active on the date that we drop it. So as of 10/1. Any other questions? Okay, great. All right, now the exciting stuff. Coming soon, stuff that's coming down the pike. We are again super excited about a lot of this. This is really, really fascinating stuff. It's really, really fascinating. It's again a show of strength in our backing of our data, and our data teams that we have in place here. This work group, all of your work is totally integral to everything we do. And so I think all of these things that we're going to talk about show just how important HMIS is. And let's talk about a few things. Now, I'm just going to say this is all just sort of like snapshots of things to come. If you have questions, please throw them my way. Some of the stuff that's more like detailed, like workflows and stuff, might not be ready to answer. But please, if you have questions about that, we can sort of brainstorm while we're on here. That's what part of this work group is for. But let's talk about a few things. So the first thing, that probably the most pressing thing, the thing that's coming the soonest, is that a word? I don't know, but is the HMIS by name list. So if you're familiar with this by name list process, we have all these spreadsheets floating around the system that have names of people, information that's tracked about them, and it's all good stuff. But we're going to move all of that the best that we can into HMIS. So we've been working with BitFocus, our vendor for Clarity. We've been working with them to go through a community feedback process. Then we worked with each of the individual groups that manage those by name lists. They took about a month or so to really come up with a product to show us. OHS has seen that final, well, the first, I'll call it the first draft of that product. And the next step here that we're about to do actually next week is we're going to do a feedback session with those folks who manage by name list. So again, that group that we already met with, we're going to have them come back, look at the final. I'm calling it the final product, but there probably some changes. And then we're going to do some training on that for everybody involved in that process. somewhere near the end of October. So we're not quite sure when that's going to be, but look out for some information on that. Don't be alarmed if you do not get invited to that training. Some of you might not need to know the details about the by name list. Some of you might just need to know how to see the list, right? And that's pretty easy. We can handle that via email. But for those of you who are going to be managing that list or are constantly in case conferencing meetings that use those lists, you're going to get trained on it and you'll know exactly the details that you need to know. What this does require. So one of the things I tried to do with all of these was sort of say, what is this going to mean for you as an HMIS provider, right? So what it does mean for most agencies is that all persons who need to be on the by name list will have to have what's called the by name list assessment that we're going to create. It has to be completed by somebody. So in order to get on the list, you have to have a by name list assessment completed, which has all of the data elements that are required as part of the by name list process. So it does require some more data entry. And so something to consider as we move forward. Any questions about that? So we're hoping to have this rolled out by November. You know, workflows and all that stuff, we're gonna sit down and figure all that out. But we're hoping November is when we're gonna be sort of go live with it. Okay. The other thing is coordinated entry redesign. So we actually just released the RFQ for coordinated entry redesign. It's on our website. You can check it out. We have basically split coordinated entry into some essential functions. Administration and housing navigation. I don't know. I'm making words up at this point. I don't remember exactly what they all are, but it has been split in a way. We're hoping to split the essential functions of coordinated entry to sort of serve people in a more effective way. Right now, everybody sort of gets the same assessments and they get all the same information collected, but not a lot of people always use the resources that we need to ask those questions for. And so redesign really is to get at this idea of identifying people for housing, making sure they're prioritized correctly, so on and so forth. But what this means is that we had to expand access to coordinated entry. So right now, Frontline, who's doing a fantastic job, is the ones they are the ones who are handling coordinated entry totally in full. But what we're doing is expanding access to coordinated entry. Now, single shelters, generally single adult shelters, are going to be allowed access to coordinated entry, which means they're going to become an access point to the system. You don't have to call coordinated entry anymore because you showed up to a shelter door and then you wanted to make sure that we get the intake done. The shelter staff can now conduct those intakes, and it takes the burden off of the phone line, right, for coordinated entry. But the other thing that we are already sort of piloting with the city of Cleveland's Home for Every Neighbor project is this idea of having outreach providers be also an access point into the system. So if you might have seen as we were doing our examples that coordinated entry dash outreach is a program, well, we think that that's probably going to be how we're going to handle coordinated entry moving into redesign. That you'll have different coordinated entry programs, we'll pull them all together. That's our whole system, you know, sort of front door information. This will require a reconfiguration of coordinated entry. So, you know, maybe we build out more programs under the coordinated entry agency, give people certain access to those programs, whatever that might look like. Again, details are fuzzy right now just because we don't know who's going to be doing what yet, but we know that essentially how we think it's going to function in HMIS. What this is going to require really close attention to is an availability of your inventory. So all programs, right? You need to be able to tell us exactly what's available and when it's available. So your data is going to have to be really, really up to date and as quickly as possible. If, you know, coordinated entry gets the phone call, you know, things will sort of go the same route. But if I'm an outreach worker and I don't know exactly what's available, it's going to be hard to push out a referral to a program without knowing. So we really need to have things updated in real time as best as we can to make sure that people are getting the right referrals to your programs. And of course, this is going to require a whole expansion of users and to coordinate entry and all that stuff, but that's on our end.
There's a question that came up in the chat.
Okay, Carla. Yeah. Carla, I'm not sure about that. Right now we've targeted the large single adult shelter, so Norma Her and 2100, but it could change. Things are ever changing. But we'll let you know.
Okay. Nick or Amanda,
Yeah.
has there been any thought to whether we would add basic center programs to the expansion?
In terms of access points?
Yes. And then
Um,
just in general, because it, typically, the youth can be younger. The YHDP covers 16 to 24.
mhm.
And so for those individuals, Basic Center would be available to them.
I'm not gonna say there hasn't been any thought put to that, but I will say is that I don't know yet.
Okay.
Like I said, we've definitely targeted just the folks that have people show up a lot right at the front door, and I hear you saying that that's probably something that happens with you all as well. Not everybody that goes into the BCPs are going through coordinated entry. In fact, probably
Right.
none of them,
None.
right?
Right.
So yeah, okay, something to consider. Thank you.
Okay.
Great. Okay. Couple other things. The Universal Supportive Housing Application. I didn't know if it was process or packet. It's sort of a new acronym. We're calling it USHAP. Um, and basically, what this is a universal housing application. So right now, we have a lot of different applications floating around for different subsidized housing options that we have in our COC. Okay. If you want CMHA, you have to have this. If you want, COC voucher, you have to have this. If you want a no service, there's just differences. Okay. And so what we're trying to set out to do, and I actually have a meeting about this later this afternoon, is to create a universal housing application that exists in HMIS so that all the entities involved, one, can complete the application and have it for all the different subsidies that are available to them, but also have everybody have access to it, be able to see it. There's not going to hopefully be there's going to be less of a paper transfer, right? Scanning documents to people, faxing them. Is faxing even still a thing? I think it is. But all that we're trying to sort of back away from. If we can use HMIS as the central hub, have everything exist within HMIS, then everyone can access it when they need it. I think that'll help with timing of when documents are signed, right? Things that we run into a lot when we are doing applications for housing. Excuse me. What this does require is going to be that uploading documents or files function that Amanda walked us through earlier. That's going to be a thing because part of the application, even though I said we're going to try and get away from paper, you still need to upload certain documents in as part of the housing application, right? IDs, birth certificates, those are all requirements of the application. So you're still going to need to do that. So that functionality is going to be increased. And then we're also going to have this inventory module. So that's why I put them on the same slide here, because the inventory module is going to be integral in making sure the USHAP process actually does what it's supposed to. And that is to connect people to actual units in the community when the time comes to do that. So the inventory module, which it's very similar to the outreach module. It's a map-based, site-based program where we can track each of our buildings that we have by unit, so we can actually see detail about each unit, which subsidy is associated with that unit, and is it available? When did it become available? So that's what the inventory module is designed to do. And so we can actually assign participants to each of those units. We can then, based on what they put in their USHAP, their housing application. So this will all sort of play together. And then what this does require for housing providers specifically is that you have to have an end user in there that can add the information about those unit subsidies and the availability, at any given time. So, I'm sure you're already tracking a lot of this if you're a housing provider somewhere, right? Like this unit's available, right? This is who we have there. We're asking you now to do it in HMIS so that the process of applying for those units can be tracked in a different way than we have in the past. Okay. I mentioned earlier, as we talked about the lease sign date, how all these dates play in together. And so it actually comes all together at the end here because the by name list has a housing offer part of it, like a portion of the by name list is a housing offer. On that housing offer assessment, there's a bunch of different dates that we've added. When is the interview? When did you get the inspection? When did you accept the housing offer, right? So there's all these things, and the whole point of doing that, and then of course the lease date, the housing move-in date, and then we have the availability dates of those units, right? The whole point of doing that is to really get a good glimpse of how long is it taking for somebody to move through the process, how long are units staying vacant, and we can have all that information in one place and pull out a really robust reporting structure. I don't know exactly what it would look like yet, but we can pull it all out and be able to determine where the gaps are in much quicker timing than we are right now. So that's really the goal of all this, is to use HMIS to make our system more efficient and effective for the people that need it. Done a lot of talking, but okay, Luke.
Hey, Nick, was wondering, question about the USHAP inventory module. Is that going to include rapid rehousing and kind of scattered site programs, or just those that are like kind of project based?
It's going to include everything. The inventory module is more for where sites, right, like buildings, apartment complexes, like those types of things. But the USHAP is really, it's going to be for all housing opportunities.
Gotcha. And then so thinking through like capacity, so we have a certain amount of folks we serve throughout the year. We typically put people into kind of scattered site locations, so we don't have like an existing open unit that we're just sitting on all year, We house people as they enter our program with private landlords all over. How would we calculate kind of a baseline inventory?
Yeah, and I don't think those are the types of things that won't be on the inventory module. I don't think the scattered site units we're going to be able to track for exactly for what you're saying. Like there's just too much change in the inventory there itself, right, and what's available.
Gotcha.
We would track your bed and unit inventory like we normally do for like the HIC, right? Where like if people are housed, we know who they are, and those, we'll count them. But in terms of tracking by unit or subsidy, like we're not going to do that in the inventory module. I can't imagine being able to even get a baseline like you're suggesting.
Okay. Yeah, I got you.
Yeah.
Thank you.
Okay. Any other questions? Those are the 4 biggies that are coming our way. Well, I guess there's a 5th one. We're going to get to that in a second. Okay. So one thing that they just dropped on us this week, so we added it really quickly to our PowerPoint here. Clarity is getting a new user interface. So a couple of things that we're not clear on yet. We're going to show it to you because we want you to be able to see it and not be shocked. But we're not sure if everybody's going to be required to change over to the new user interface. And we're not quite sure if Clarity is actually even going to make everybody do it, right? So if Bitfocus says, yeah, by this date, we have to have everyone switched over to the new user interface, okay, then we're going to have to come up with like a really quick plan to make sure that, and be planful. We're going to be planful about it, but we're going to have to try to figure out a way to get over to the new user interface. If they say, oh, this is just a testing period, we just want you to pilot, which is what we've heard so far, then we might not switch. It just depends on sort of what's happening. But I figured we show it to you because it looks cool, it's different, it's new, it's exciting, okay? And if you've been in Clarity a long time, you might end up hating it because it looks different. But they just wanted us to introduce it. The way that Amanda and I have sort of planned to tackle this, again, what we've heard from Bitfocus so far is that they really want us to like pilot it and get some feedback about it. And so Amanda and I are going to come up with a plan to do so. We'll select certain entities or agencies to have the access to the new user interface. and then, come together as a group for that pilot group and figure out, how it worked or what you liked, what you didn't like, and then provide that feedback back to BitFocus, as they've requested. Things look a little different. So now all those tabs that you had at the top are now to the left: profile, privacy, household management, history. Everything's over here. This is how data is presented. So looks a little different. Over on the right, you can see active programs, all the stuff that you were able to see just in a different way. Active programs, you can see those and you can go right into them from there. Active services, if they have like an open service. The programs tab over here, right? These are the programs that they're enrolled in. And because they're enrolled in that program, I don't have the ability to enroll them in anything else, but that would show up underneath here, right? So it's just a different look. And the reason that they've unveiled this and want us to try it out is actually better on the mobile devices. So there was a need to make sure that things were a little bit more mobile friendly for people who are doing more work out in the field. That's what they've said in the demo anyway. But I think it's just for ease of access. One of the things too that I thought was interesting and I think it would be helpful is up here as you go in through different tabs, okay, you can easily get back to one of your previous tabs, right? Before you had to use the back button, you had to go back to the search screen, then go back to the profile, and then go back to the programs. From here, I can actually just follow the path that I followed to get where I'm at, and I can actually click back into where I was. It's different. There's also a cool dark mode, which if you're stare at a screen all day, dark mode is nice because you don't have to have the bright purple or white screens in your face all the time. So any thoughts, initial reactions? Okay, I like it. All right.
Hey Nick,
Yes.
I have a question. Will the new enrollment look like this too? Because I like this.
Yeah, so good point. So here's when I clicked on that enrollment, you can see the entry here. So this is it. It went right into the entry screen. You can see all the data that's entered in on it, right? And so if we needed to edit it, things would look like this.
Okay, that's what I want to see. Like the initial when we go in to
Yep.
put in a new person, will it look different? Okay, yeah, I like that.
Yep, it'll look like this. Yep. And as you click on things, some of the same things exist, right? The switches and change is good. Yes, that's right, Jeanette. Okay. It's good.
I will note here that when we first found out,
sorry. Go ahead. Sorry. Go ahead.
when we first found out about the new user interface, Nick and I were like, oh boy, something big change coming through. But then as we were kind of digging a little bit more, we're like, we kind of, are liking this just because we think the flow will be better. And like how Nick had pointed out at the top there, it's easier to navigate kind of going backwards instead of, having to hit the back button or kind of losing like your spot where you're at. We just think that the flow will work a little bit more easier for you guys. So I know change can be a little, scary at first, but like we said, we don't even know if this is going to come out full for everybody, but if it does, just be open to it. And if you are interested of being, like the pilot, send us an email if you want to kind of be the people to kind of try it out first, and we'll take that into consideration when we're coming up with a plan of how to get the pilot out there for you guys.
Yeah, absolutely. And the beautiful thing about it, like I said, is that it's really, if you like are using it and you're like, man, I lost my place because of the new format, I don't know where I'm at. It's actually super easy just to go right back to where you were, right? Just right back to the other interface. So you're not stuck in it. You're not going to be forced to use it at every step of the way, but just something to consider. But I like that this is good. Printing look different when people need the history. That's a good point. I didn't even click on the history. So it does look different, right?
Yeah.
And
you know how we would do it for people who need the PSH history attached to those apps? that's why I wanted to ask, is that going to be different? Because normally we highlight and we save as a PDF and it prints it pretty consistent. But I just wonder, with this interface change, will that proceed the same, or is there a better option of printing with this new update?
Yeah, it's a good point. I'm not sure. I'd have to play around with this, I think, a little more. Um, yeah. The only thing I don't see, there used to be like client level reporting. I don't see that anywhere. Maybe I'm. Oh, interesting. Yeah. See, we haven't, like I said, just dropped this week, and we're like, you know what? Let's throw it in. Let's show them. Yeah, I know. Change is hard. I hear you, Sharon. But I'm hoping that this is a good change, and that, like I said, I don't think they're gonna force it on us. From what we heard so far, I think it's gonna be pretty simple change. But I'm recognizing it is 11 o'clock, so that is the end of our time together. But one of the things that, if there's any, or I should say, one of the things that I want to make sure you have time for questions. If you have any additional questions, if you want to go back to anything, you can shout them out here. If not, you're free to go. Thank you for joining us. We will make this available. The slide deck and the recording we will make available to you. We will scrub the data. I apologize for that. And if there's nothing else, like I said, you're free to go. Thank you very much. Yeah, Vita.
So Rita and I were chatting a little bit about the dates, especially for Norma Her with the move-ins, right? And so I just wanted to confirm on the shelter level, will it be different than those that are the actual like leasing places for us when we're closing and those move-in dates? Because someone can go get their keys, and I know Rapid Rehousing had, when I was in that rural, had their rules, someone had to be moved out as soon as they got their stuff, right? Or within 24 hours, something like that. So how would we necessarily do that? I want to be clear that I at least understand. So if someone gets their keys, signs a lease, because in the general world, you sign a lease on 10/30, you're getting your keys on 10/30. You're not getting your keys on 11/15. You get what I mean? So I just want to better understand that from the data portion of how we would use that.
Yeah, so I think for the shelter providers, things shouldn't change for you. You still should be exiting people when they are physically no longer with you. I think what I'm trying to do by making the change, I'm not saying but what we are trying to do by adding the lease date is avoid exactly what you're talking about, right? So if somebody gets their keys, signs their lease on 10/30, and that's the date that the lease sign date would be, that hopefully the PSH provider, who is then moving that person into that unit, right, will be able to put their enrollment date, have the lease date, and then use the move-in date that'll come after, excuse me, your exit. So that's what we're trying to avoid is, like you said, right? Like, you don't need to change anything because they're physically still living in your unit or in your bed. They're staying in your bed. The PSH provider would be responsible for making sure that the housing move-in date comes after they've exited shelter, because that's when they're physically taking over the unit.
Okay, so the PSH would put that date in.
Exactly. Yep. It's only going to be available for rapid rehousing providers and PSH providers.
Okay.
And I say providers, I should say programs. So like the Y, right? You have Norma Her, but you also have Cogswell. So Cogswell will have that, but you won't at Norma Her.
Okay, got you.
Yep.
Okay, that makes sense then, because I'm like, wait, I don't know how we would, run that. Okay, then all right.
That's a good question.
Thank you.
Yep. Right. Well, thanks again, everybody.
Have a great weekend, everyone. Bye. Thank you.
Bye-bye.
Bye.
Thank you. Bye.
Thank you.